And experts now warn wars overseas could lead to a global health crisis. They say while people in war-torn areas suffer physical and psychological distress, others could also suffer mental and physical health issues due to fear and stress. ABC News medical contributor and physician at Stanford Children's Health, Dr. Lok Patel, is here with more on this. Dr. Patel, how does this work? How can people with no direct connection to these wars suffer mental and physical effects from them?
Simply put, Diane, we are wired as humans to be empathetic creatures. When we see or hear stories of others who are suffering, it does affect us. And anyone who has worked with trauma survivors can attest to the fact that we can experience something called vicarious trauma. We see the images, we hear about what is happening to people who are displaced, who are injured, whose friends or family are at risk, and that can actually cause symptoms of post-traumatic stress. You can have depression, anxiety, and a lack of sleep as we were trying to figure out what possibly could be a solution to end all the suffering. And it's important to note, as you mentioned, that this goes far beyond the physical effects of war, whether that's crush, burns, or injuries, but there's these indirect effects as well, such as a lack of healthcare access, displacement for so many millions of people, lack of food, water, sanitation, effects on maternal health, children's health, and these broad scale effects on mental health for people. And this affects hundreds of millions of people worldwide because of all the conflict out there. This is a global health catastrophe.
Now, Dr. Patel, these experts say that, I'm quoting here, indirect health effects sometimes linger long after the war is over. So how long are we talking, and how can you tell if this is affecting you in a way that calls for professional help?
When we look at the indirect effects of war, we look at studies, and you can look throughout time of the effects of war in Latin America, Southeast Asia, Syria, Ethiopia, Yemen, Ukraine, and now what we're seeing right now in Israel and Gaza. It's simply astonishing to look at what can happen when you take down the healthcare infrastructure of a war zone, and all of a sudden people don't have access to preventative care or the ability to manage chronic health conditions. This can last an entire lifetime. There are studies looking at the risk children are in when they're born into a place of conflict, how that can affect their long-term development. And toxic stress, it is awful for our brains and can increase our risk of so many different health conditions. And people out there who are witnessing this and can feel those senses of guilt, of helplessness, of anxiety, and they're losing sleep. It's so important to check in on yourself and look to see how this is affecting your day-to-day functioning. And it's okay to take a step back or ask for help as you're trying to process what is happening.
So, Dr. Patel, what can people do to take care of their physical and mental health right now? And how do we do the same for our kids?
It's really important for people to take some time for self-observation and ask yourself how you are doing. How is your mental health? Check in on your friends and family. And it may seem counterintuitive for a population who wants to pay attention to the news, but taking breaks away from news headlines, away from social media, and encouraging this for your kids can not only be good for our mental health, but can actually help our brains process what is going on, our emotional regulation, our judgment. It's also a really good idea to ask for help, encourage people around you to do the same, whether that's going to your friends, colleagues, or therapy. And Diane, last but definitely not least, is think about trying to channel your energy into something actionable. Is it working on an advocacy project? Is it donating? Is it talking to people who may have friends or family who are affected? Is it something that you feel like you can do that's constructive? Because I think right now, the major message is as we are waiting for the world to find an answer, to find a way towards peace, we can all do better for ourselves to be more empathetic and compassionate.
I think that is something we can all try to do. Dr. Patel, thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.